Within the GPS therapeutic pathways for rehabilitation concept, we can use many different modalities that complement each other and that make our work more effective and efficient. So whenever we use, for example, the TCare, we can try to combine the MiTo synthesis table and the Archimedes system in order to improve the way that we work. When we're using the TCare cellular regeneration, we usually have about 4 phases in the therapy. We have a warm-up phase, and then we have a passive therapeutic phase and an active therapeutic phase, and then we have a cool-down phase where we just add some cellular regeneration impulse. But what I want to show you here is how we would use this during the active therapeutic phase. So what we're going to do is we're going to mobilize at the same time as we're introducing resistive radio frequency here, and we're using about 1/3 of the energy emission, and we would do this normally for about 6 minutes. And we'll just start here by adding, first of all, some contact cream, making sure that there is a lot of contact between the handpiece and the skin, and we would first of all work very passively, just there where we need to work. On the spine, along the spine, it can be the facet joints, or we can focus on the disc. And of course, we often ask our patient for some feedback in terms of how much heat are they feeling. Do you feel any heat for the moment? Not yet? Okay. So that's fine. We need a couple of minutes to reach a certain temperature anyway, but what happens is we can turn this into a more active exercise by simply lowering here, lowering, and then we can start mobilizing our patient. Now when we're mobilizing our patient, we are increasing the blood flow, and by increasing the blood flow, also the temperature that we want to reach deep into the body, we'll start increasing the skin temperature, and our patient will sooner feel that kind of feeling of heating along the skin. What we can do also is we can just remain here and we can ask to do some resistance. Okay, and against my hand, push, 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 and release. And again, push, 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 and release. Are you feeling some heat already? Okay. So when we start moving, she's now feeling some heat immediately. What we can ask her to do is to also actively move. Just actively, we're just going to lower a bit and just actively move. And now the muscles are working. You can move left and right. There we go. And by adding the radio frequency, we are getting more movement. And another benefit of using the MiTo table can be, for example, that we're just going to alter the position of the thorax and go into more flexion and have the same effect again in this position. And there where there's, for example, pain, we can heat. We can use the cellular regeneration effect and the pain modifying effect, and doing everything at once. And usually if we would do all of these things separately, we do everything for about 10 minutes. And what we're doing now is just in these 6 minutes, we can do everything together and work more efficiently.